Welcome back. Thanks for joining us this evening on South Africa Tonight. While we've got COVID-19 cases in the Western Cape and Kwa-Zulu Natal, which are continuing to rise, while new cases have been declining in other provinces, most notably in Gauteng. So the two coastal provinces are showing a worrying upward trend. To discuss what could be the main contributing factors to the spike in the new COVID-19 cases in these provinces, I'm now joined by Professor Linda-Gail Bekker of the Sisonke Programme and Director of Desmond Tutu HIV Centre. Prof, always a pleasure speaking to you. A very good evening to you. So we've seen within even the 24-hour cycle and even for a few days now that the Western Cape as well as Kwa-Zulu Natal are showing significant increases when it comes to COVID-19 infections. We've seen that Gauteng is even a little bit lower than the two provinces. What is this saying about the trajectory now of this pandemic?
So, Faith, thanks. I think, that perhaps the take-home is that the virus is in control. It seems to, as we saw in wave 1 and wave 2, it starts in certain areas of the country and then moves to other areas. In this case, for the third wave, there was a beginning in the mid-region, particularly Gauteng, and now it's moving further out. And I suspect this has something to do with the fact that the Delta variant is now moving more, consistently into those areas. And so we are seeing breakthrough infections for individuals, even though they may have been exposed to other variants of the virus. And we know that even if vaccinated, individuals may still see some infection.
Yeah, I mean,
the important thing is...
Apologies, Dave.
Sure.
Prof, when we're looking at, for example, the likes of the Western Cape, I mean, in the 24-hour cycle that we've seen, it's detected the most cases, about 3,000, over 3,000 cases, in fact, that have been tracked. When it comes to the situation now in the Western Cape particularly, is that a growing concern? Are we likely to put on our alarm bells with what's happening there?
Yeah, I think, that when we see those numbers going up, then we should all be alarmed. I mean, it means the virus is actively transmitting, there's community spread, and it means we have to take all the precautions we can. And again, that really affirms that people need to be careful of the 3 C's, so they're crowded spaces, closed environments, going out where they may be in close contact to other individuals. They have to really think twice about that and certainly avoid large gatherings as much as possible. And of course, where possible, vaccinate. That has to be a top priority.
Yeah, I mean, interprovincial travel, it is allowed. But how much of this interprovincial travel has contributed to the numbers that we're seeing now? And that's just taking into account, for example, with what we experienced within the past 3.5 weeks or so in KZN, with what we understand about the Western Cape, where many people coming in from the other provinces as well, Gauteng, Eastern Cape, to go into the Western Cape. How much of that is contributing to the numbers that we're seeing?
Well, Faith, the virus really needs, new human hosts to spread to. And so the more that the virus is transported around in people who are already infected, perhaps asymptomatically, that is exactly how it moves around. It needs to go from human host to human host. And if we travel and if we gather and if we go to, spaces where we can be in contact with others, that's exactly what the virus needs.
But when we're comparing these numbers and back to the point of interprovincial travel, Prof, when we're comparing the numbers that we're seeing in the Western Cape, in KZN, where we're seeing the spike, and then when you use the likes, for example, of the Limpopo province, right, even of the Free State, we can still say that people will either work in Gauteng and then travel to Limpopo over the weekend and vice versa. But we're not seeing significant increases when it comes to those provinces. Are they doing something different that Gauteng, the Western Cape, as well as KZN are not doing?
Faith, I'm not sure we know this. In fact, even just today, we were talking about what could possibly be driving this. I actually don't know that we know this. Is it the fact that more people have been, exposed, that there is more background pre-existing immunity? I am not sure that we really know what may be driving some of this. Obviously, our response has to be that we take all the precautions we know in terms of non-pharmaceutical interventions, and we continue to vaccinate as much as we can. That is all we can do, and we must do, and reduce, as I say, as much person-to-person contact as we can, particularly when your province is in the midst of a surge, such as I know I'm aware I am in at the moment now in the Western Cape.
I mean, given the fact that you are in the Western Cape, Prof, what is the sentiment like, especially amongst healthcare professionals? Because if we have anything to go by, and Gauteng is an example, as soon as we saw that surge, hospital capacity became another big problem. The stress that's been imposed now on healthcare professionals was another added cause for concern, as well as the psychological impact, which we never speak enough about, the psychological impact of this COVID-19 virus.
Yeah, I mean, I think our health workers, healthcare force is tired. This has been a really long road, and sadly, I think it will continue still for some time. And so, we need to, first of all, acknowledge the work they do and be appreciative of it. The second thing is to take as much care as we can to reduce our own risk of getting the infection. And then thirdly, look at other aspects of reducing trauma, reasons for hospitalization, etc., to try and alleviate the burden as much as possible. I'm delighted that we were able to ensure that as many of the healthcare workers as possible were vaccinated. So we know that at least we've removed that concern, that, they would be facing all the anxieties of going down with COVID themselves, with unknown outcomes. I think that has been really very important to do, but there's no doubt that this is tough for healthcare workers and those who have to go to work. Essentially, of course, it's a big undertaking.
Yeah. Prof, how then do you start with the balancing act, right, of the vaccinated versus the unvaccinated? If Europe, as well as the US, is anything to go by, if we do not handle this matter carefully and intricately, we could have a situation where we've got the vaxxed against the unvaxxed and vice versa, which is really a polarization of society. How then, in the South African context, are you planning, even as healthcare workers and within this particular field, of navigating this situation?
Well, I think, I'm of the opinion that each one of us needs to take responsibility for our own health, particularly, as adults. I think this is critical. And then, of course, as parents, we take responsibility for the health of our children. But there's no doubt that the vaccination is something we should do for ourselves, because if we become vaccinated, we know that we are taking the greatest precautions to prevent severe disease and death. And that's what I hope every South African will consider carefully, and then do everything they can as a result to actually lay their hands on a vaccine if they can. Now, clearly, we have to move from one end of the country to the other end in terms of the vaccination. And the way government has taken, which I think is a reasonable one, is let's start with those who are most vulnerable for a poor outcome. And that, of course, are the aged. So I think it is correct that we started in the eldest part of the South African population. We kind of working our way down age-wise, I think was the right thing to do. I'm delighted that the national rollout is now really taking off. I really, really, again, exhort every South African, if you have a chance, get registered, get vaccinated for your own well-being. If not, don't even necessarily think about the people around you. Do it for yourself. And that I think is a strong message, and maybe the best way to appeal to everyone, even those who are sitting on the fence.
Professor Linda-Gail Bekker, always a pleasure speaking to you. Professor Linda-Gail Bekker is from the Sisonke Programme and Director of the Desmond Tutu HIV Centre.